Hi, it's Jessica DaMassa with WTF Health. I'm here at Bayer G4A's signing day. And hey, did they sign you or what? Is that what happened?
Signed yet? No, we haven't signed.
Not signed. This is Glen Tullman. He is the chairman of Livongo. How's it going?
Everything's great. We had a great session here. A lot of young, great entrepreneurs here, and I applaud Bayer for our buyer, as they say in Europe, for what they're doing here.
All right. So speaking of Europe, what are you doing here in Europe? Is Livongo going to jump the pond?
Well, they invited us over here, and look, the reality is we have a great market at Livongo in the U.S., and we're going to continue the growth there. You know that we just signed our largest deal in our history with the federal government, so we're excited about that. On the other hand, we know that the challenge of diabetes and hypertension and weight management and behavioral health is an enormous challenge all around the world.
Absolutely.
And so at some point we will jump the pond, and we want to find the right partners, and but we're not ready to make that decision just yet. Sorry, you can't get me to say it just yet.
I know. I mean, I know that. That's par for the course with you, just like you were never going to IPO. So I wanted to pick your brain in the spirit.
We never did until we did.
Yeah, okay. The ticker is running along the bottom of this right now. So I wanted to pick your brain from a startup standpoint. It's been a while since we've had a conversation about this. And I, in the spirit of this event, I think with so many startups there who are going to be looking at this, give us some advice. Let's do like a rapid fire series of questions about some advice for some startups.
So rapid fire. So first of all, pick something you love to do that you're passionate about, because you don't know how long you're going to be doing it. So anybody who says, I'm going to do this IPO because, or I'm going to do this company because we can IPO, you don't know if that's going to happen. So pick something you love to do where you can make a difference, and then build a great team around you. And that's the advice.
Okay.
It's just that simple.
Okay, I'm going to ask you about the hockey stick curve.
Okay.
So I had heard somebody, and I want to check this advice with you, who said that a lot of startups make the mistake of rushing through that part where they're below making revenue. Do you think that that's true, that a lot of startups rush through that?
Well, I think a lot of startups do, and I think what you have to do is balance acting rationally with growing the business. So if you're truly reinvesting in the business in a smart way, then it's okay to not make money, and it's okay to have a hockey stick. But then at some point you actually have to have a plan, and you have to have a methodology that says, if we stop growing, we can actually make money. And we have that at Livongo, which is one of the reasons that I think people were excited about us.
Walk me through the contract with the federal government, because at that process, I mean, like, I'm sure, like, people, I mean, this is the biggest contract that you guys have landed to date.
It is.
So congratulations on that.
Thank you.
But I want to hear, like, the pain and the horror stories about this. How long did this take? How did it go? Were they, I mean, what kinds of things did they look at when they were evaluating Livongo as a solution? Because this is kind of new for them.
That's right. It's new for them, and in some respects, you know, this is a challenge for any startup. To work with the federal government, you need years of data. So, you know, when people say, was it competitive? In a sense, it wasn't, because no one has 3 years or more of sustained, measurable data, particularly in diabetes, that shows an improvement not only in clinical results, but in cost. And we had that. So
was that like the single mitigating thing for them?
That was the single biggest factor that they had. And then second, they used some of the Blue Cross Blue Shield plans, actually used our product for the last year and saw great results. And those were the two things that actually allowed us to move forward. But I would not start a business depending on getting a government contract. It's a long and torturous path to do that.
Well, no, I mean, I think people are like, I can't even work with this hospital system in one department, let alone the federal government. I can't even. All right, so now you're in a position, I mean, obviously everybody watched with great, the fanfare that was the IPO, that was sure never going to happen, right? But so on the other side of this now, you guys are looking at startups to acquire. I mean, it's no surprise. What do you guys look for?
I mean, say that, but okay.
Can you just?
So
what are you guys looking for when you guys look at startups that you want to partner with? Because this, I think, is going to be a common theme here in the next couple of years, going through in digital health.
We want to look at, we're focused on the whole person, and we want to look at products that, one, people love, two, that actually improve the clinical results, and three, where we can see cost savings. And if we see that, then we want to see how will that culture of that company fit with our culture, and how can we put it on our platform, because it's going to ultimately be the same tech stack.
Yeah, I think we're starting to see this.
One experience, whole person is what we have to go to.
Okay. All right. Other advice for startups about funding. So, I mean, obviously, I mean, it's never a good idea to take bad money, right?
Yeah.
But how do you know when to take the next step?
I think.
I mean, truly, I tease you about it, but
Yeah.
you were very much like, we're not going to go through an IPO and have to respond to a whole different group, shareholders, a different board, until we absolutely need to. So how do you know when you need to bump up to that next level?
I think that you have to figure out what does the business need and who are the right partners, and it's that simple. And then you just go through that.
As far as assessing the business needs, like you're putting, I mean, is there something that you have like a golden rule about when it comes to like, this is how we do what we're going to do?
No, I think you're managing growth and you're managing, and again, I think most startups, the biggest challenge they have is they hire too quickly and they spend money like it's not their own. And so I think in both those situations, you have to be cautious.
Okay.
No matter how much money you have to be cautious.
So you mentioned hiring the right team, and I
Yep.
want to go back to that for a second because
Okay.
you have assembled like a super team of friends at Livongo. So what do you like? What would your advice be to a startup? And let's talk like, I guess, kind of early stage in that pivotal time when it's like you need somebody who's going to be like your ride or die more or less
That's right.
from the beginning to the end. So what do you look for in a good person to add to the team?
I think you look for commitment, so that's one thing. You have to have people who are passionate, and so about a third of our people at Livongo actually have a chronic condition or have a family member who does. Second, I don't think you hire for the end. I think you hire for what you need at the time. And that's kind of a misconception. You know, we knew early on that at some point, some of those people, they didn't have to leave, but they wouldn't necessarily be the people who would lead us to the next stage. So if you look at Livongo, the reality is, whether it be our CTO, we made a change there. Whether it be our chief marketing officer, we made a change there. And as the company grew, the needs changed. That doesn't mean that the people always leave. It just means that sometimes they get somebody who they can learn from, you know, AKA a boss. And that's just what happens.
All right, you've done this not once but twice, scaled up a company, right? Why did you do it the second time?
Well, because I love what I do. This is what I love to do, and so, you know, it's fun. If I didn't do this, what would I be doing?
Oh my God, you'd be harassing people who are trying to
and
report on the
changing
industry.
the world is really important, and it's something that's worth doing, so it's worth our commitment.
Absolutely, absolutely. So that's exciting. I love the passion that you guys have, and congratulations again with the government contract. Looking forward to anything else coming down the pike that you can share with us?
Not that I can
Oh
share.
my God, never.
But everything. We're looking forward to making healthcare better.
Well, good. Thanks so much, Glenn, for
Thank
joining
you.
us. It's always a pleasure to talk to you and never get any answers about anything big. I'm joking. Thanks for all the good advice for the startups. I'm Jessica DaMassa with WTF Health. Thanks for watching.